breast cancer. From one disease to hundreds of molecular diseases. Dear audience, what is the reality? The reality is breast cancer is a common cancer in women. It is the leading cause of cancer death, high heterogeneous disease, and global health challenge. What changed? Of course, molecular subtypes, genomics, AI diagnostic, immunotherapy, and precision medicine. Now, the central question is, how did breast cancer evolve from a single diagnosis to a precision oncology model? Here is just a roadmap from diagnosis to treatment. This includes histology, molecular subtypes, genomics, AI, and personalized treatment.
Welcome to this explainer where we're going to break down the absolutely incredible evolution of breast cancer research. We're going to move from the big picture global perspective right down to the microscopic cellular level to really understand a disease that affects millions, yet is finally yielding to some of the most advanced, cutting-edge science of our time. To make sense of all this dense science, we'll use a zoom-in, zoom-out approach. We'll start with the global breast cancer landscape, decode the molecular subtypes, look at the sneaky mechanisms of tumor progression, and then check out next-gen diagnostics, precision treatments, and holistic long-term patient care. All right, part 1. The breast cancer landscape. Let's understand the global scope. So to ground ourselves, we have to look at the sheer scale here. Breast cancer accounts for roughly a third of all malignancies in women, and it's responsible for about 15% of all malignancy-related deaths worldwide. Cases are actually rising globally, mostly because of population growth and shifting lifestyles. But here is the silver lining. Thanks to the cutting-edge science we're about to explore, death rates are actually predicted to decline as prevention and early diagnosis continue to improve. Now, how exactly does this happen? It usually comes down to what we call the two-hit model. Think of it like a 1-2 punch. The first strike? That's often inherited genetic risks, things like BRCA1 or 2 mutations. But then comes the second hit, the one that pushes a cell right over the edge. This is your environment or lifestyle. We're talking long-term estrogen exposure, everyday lifestyle choices, and even surprising things like circadian rhythm disruption from messed up sleep cycles. It's this wild, complex interplay of genetics and your environment that really sparks the disease. And this disease doesn't just happen overnight, right? Normal cells don't just suddenly become cancerous. It's a step-by-step biological sequence. They adapt, they mutate. It usually kicks off with hyperplasia, just simple cellular overgrowth. Then it moves into pre-malignant changes and eventually to in situ carcinoma. At that point, the pathological cells are still safely locked inside the milk ducts. But if they're left unchecked, that's when they acquire the tools to break through those natural boundaries and become invasive carcinoma. Moving to part 2, decoding molecular subtypes. Because as we know, this is way beyond a single disease. If we zoom in microscopically, the data clearly shows us why a one-size-fits-all treatment is completely obsolete. The largest chunk, about 70%, is hormone receptor positive and HER2 negative. Then you got HER2 positive sitting around 15 to 20%, and triple negative, or TNBC, making up the last 15% or so. Basically, a tumor's specific molecular signature totally dictates how it behaves, how aggressive it is, and crucially, where its weak spots are. It's wild to look back and see how fast our understanding has evolved. Like back in the year 2000, the whole concept of molecular typing was just getting started with basic microarrays. By 2009, we were using 50 specific genes to refine these subtypes. Fast forward to 2012, we started integrating genome and transcriptome data to find entirely novel subgroups. And by 2021, we hit a breathtaking new frontier. We started using single-cell methods to stratify these complex cellular ecosystems into 9 distinct clusters. I mean, we are literally mapping the neighborhoods of these tumors cell by single cell. Part 3. Mechanisms of tumor progression. Let's crack open the tumor's survival toolkit. And let me tell you, tumors have a terrifyingly clever toolkit. They use tumor stemness, this small, stubborn population of self-renewing cells that drives treatment resistance. They use cellular senescence, basically aging cells that pump out factors to hide the tumor from our immune system. They literally hijack cell death pathways and rewire their own metabolism to survive under stress. But get this, perhaps the most mind-blowing part, they actually use local bacteria. Yeah, intratumoral microbiota. Bacteria literally travel with the tumor cells in the bloodstream, acting like a physical shield against fluid shear stress. It is a crazy, sophisticated defense system. Which brings us to a really crucial, albeit frustrating concept, tumor dormancy. This is when tumor cells spread to distant organs, like the liver, the lungs, or the brain, and then just go to sleep. They can remain inactive for years, sometimes decades, before suddenly reactivating. They're basically sleeper agents, held in check by the immune system, just waiting for an environmental trigger, like aging or tissue scarring, to wake them up and start dividing all over again. Okay, part 4. Next-gen diagnostic technologies. Catching cancer earlier. Zooming back out to human ingenuity, one of the most absolute game changers in early detection is ctDNA, or circulating tumor DNA. These are tiny fragments of tumor-derived DNA that get dumped into the bloodstream when a cancer cell dies. Think of them like molecular breadcrumbs. By picking these up in a simple, minimally invasive blood test, a liquid biopsy, we can pinpoint occult cancers and even brain metastases way before traditional imaging could ever spot them. It's a massive leap forward. And we can't talk about diagnostics without talking about AI, right? Artificial intelligence is making waves in a clinic. AI-assisted radiologists are actually decreasing false positive rates by a massive 37.3%, all while maintaining the exact same level of cancer detection sensitivity. So to be clear, AI is definitely not replacing doctors. Instead, it's stepping in as a hyper-vigilant digital assistant, crunching mountains of image data to reduce patient anxiety, skip unnecessary biopsies, and seriously cut down on diagnostic errors. Moving right along to part 5, the era of precision treatment. Targeted therapies and minimally invasive care. When you compare the traditional approach to the modern precision approach, you really see this new surgical philosophy of less is more. By hitting the cancer with highly targeted preoperative therapies, we can shrink tumors before the patient even hits the operating table. This spares patients from irreversible physical damage. The days where a radical mastectomy and total lymph node removal were the only options, those are fading. Today, breast-conserving surgery and sentinel lymph node biopsies are completely redefining the standard of care. A huge driver of this precision is a brilliant new class of drugs called ADCs, or antibody-drug conjugates. These things are literally cellular smart bombs. They combine a tumor-seeking antibody linked directly to a highly toxic payload. The ADC actively hunts down specific receptors on the surface of the tumor, gets swallowed up by the cell, and then, boom, it releases its toxic payload from the inside out. It destroys the tumor while effectively sparing the healthy tissue around it. Truly incredible stuff. So let's look at how treatments are mapped to those specific subtypes we talked about earlier. For HR-positive disease, the standard is endocrine blockers, but now we've got novel strategies targeting the PI3K/AKT/mTOR pathways if the tumor becomes resistant. For HER2-positive, we use dual antibody blockades with those amazing ADCs we just mentioned ready as a heavy-hitting backup. And for triple-negative, which historically only responded to really harsh chemo, we're finally seeing real success with PARP inhibitors and immunotherapy. The big takeaway here? Oncologists now have highly specific, targeted backup plans for literally every single patient profile. Finally, Part 6, Holistic Long-Term Patient Care. Treating the whole patient. Because modern oncology doesn't just attack the tumor anymore, it aggressively manages the toxicities of the treatment itself. We're talking interventions like cold cap therapy to prevent chemotherapy-induced hair loss. There's cognitive behavioral therapy for insomnia, and absolutely crucial options like ovarian suppression and embryo freezing to preserve a patient's fertility. We're even seeing AI chatbots checking in on daily symptoms, digital rehab, and diet plans packed with plant-enriched whole foods. The ultimate goal is making sure patients preserve their fertility, their hair, and their sanity through the entire grueling process. You know what's really fascinating? The profound biological impact of simply moving your body. Aerobic exercise during and after treatment significantly reduces fatigue and improves sleep. But check this out. Clinical studies show it can actually change the tumor microenvironment to actively lower the risk of the cancer coming back. Physical exercise is literally being prescribed right alongside medication, acting as this powerful, natural biological modifier. And mental health is finally being given the exact same weight as physical health. Through psychological support models like acceptance and commitment therapy, patients are being empowered to handle that lingering, deep-seated fear of recurrence. By actively accepting their emotions and focusing on value-inspiring actions, patients can process their trauma and reclaim their mental well-being, which, let's be honest, is just as critical as the physical healing. Which leaves us with this final, thought-provoking question. As AI and targeted therapies continue to evolve at breakneck speed, are we entering an age where breast cancer is no longer a life-threatening disease, but a manageable condition? We've seen today how precision medicine has completely transformed our approach to this formidable adversary. We are mapping it, predicting it, and disarming it, cell by single cell. It's a hugely hopeful thought for the future, and one that science is working tirelessly to make our reality. Thanks for joining me for this explainer, and keep learning.